Hi, my name is Crystal Gilbert, and I am here to present my comprehensive project over pediatric pregnancy and labor. This is going to be a review of assessment and the progression of each stage. So first I'm going to start with pediatric growth and development. This is going to start, I'm going to use Erickson's stages of development to kind of go through my growth and development of the pediatric stages. So this is only going to use where my arrow is for the infant through the 13 to 21-year-old. So the infant can establish trust when the baby's basic needs are met for food and shelter. This helps the infant develop a sense of security and learn to trust others around them. Mistrust and anxiety can result when these needs aren't met for the infant, affecting their interactions with others when they grow up. So that is the first stage of Erickson's for infants. The next stage is for toddlers. You'll see in this blue color, which is 18 months to 3 years. Toddlers can struggle with personal control and establishing themselves as their own individual selves. This is when they may want to be independent of their parents and wanting to dress themselves and feed themselves. Toddlers that are not able to take care of these needs themselves and have to rely on their parents or caregivers may develop shame. So the other side of this may develop shame when they see their peers being able to perform these tasks that they are not allowed or cannot or have not learned how to do them themselves. So they develop shame and doubt of themselves. Preschoolers, the next age range from 3 to 5 years old, the preschooler begins to learn about themselves and the social world that they live in. They want to know and try out new things and learn to cooperate with others to achieve common goals. This gives them a sense of purpose. Also during the stage comes the perpetually never-ending why questions. They want to know everything. These children are just curious about the entire world. So, however, if the preschooler is discouraged from exploring this new world, such as with over-controlling or strict parents, the child may develop a sense of guilt. This guilt leads the child to believe that they are a nuisance to the world and to others, which can hinder their social and creative lives that they would have become as they grow up. School-age child, which is going to be the 5 to 13-year-old, the industry versus inferiority. This is the competition stage. They want to do what their peers can do and do it better. They want to be the best. This comes with the school-age child comparing themselves to their peers and leading to validation and confidence. If they are discouraged from doing these activities that allows them to compare themselves or feel that they just don't measure up when they do compare themselves, they may get this sense of inferiority. They feel inferior to their peers. The next stage, 13 to 21-year-olds are going to be the adolescents. During this time, their child is shifting into an adult. They begin to contemplate what they want to be in the world. Where do they fit in? Those that are able to develop and explore potential possibilities will develop a strong sense of identity. Those that are discouraged to find and develop, to try and fail and try again, may develop a sense of confusion of their own identity and their future. This may end in the adolescent following other people's ideas, which may end in a place not so good. Okay, so pregnancy progression, I'm going to go through the maternal and then I'll go through the fetus for each trimester. The first trimester, we're going to see amenorrhea, so that's the absence of her menstrual cycle, her period. And we're going to use that and take Nigel's rule. So this is going to determine her estimated date of delivery based off of her last menstrual period. So that rule entitles us to take -3 months plus 7 days, and then of course the next year to determine about when she should deliver. Goodall's sign, which is the softening of the cervix, and Hagel's sign, which is softening of the uterus, is going to occur during this first trimester. Linea nigra, which is the dark line that may occur on some pregnancies down the center of the abdomen through the umbilical cord, umbilicus for the mother, may occur due to the hormones, striae gravidum, which is essentially stretch marks, and then urinary frequency and morning sickness, of course, are always going to be present during the first trimester due to those hormones. The baby, the fetus, so we are going to have a first heartbeat around 8 weeks. The cardiovascular system is starting to develop. The neurovascular system is also starting to develop. So it's very important that the mother start prenatal care and prenatal vitamins, looking at that folic acid, trying to prevent neural tube defects. Second trimester, we're going to see quickening, which is the fluttering of the fetus. So first signs and symptoms of the mother feeling the infant moving in their belly. They may also have supine hypotension. So when the mother lays flat on her back, the weight of the baby, because the baby's now larger, is going to press on her vena cava and decrease the blood pressure in the mom, which in turn is actually going to decrease how much blood is being perfused to the infant. So it can also cause some concerns with the infant. The baby during the second trimester is going to have all of its organs and systems are going to be developed. This is when you have that 20-week ultrasound for the gender reveal, but it's really the anatomy scan, so every system is really looked at to see while it's in the beginning of each system's development, if any abnormalities are occurring. And so this is really important scan to not miss during this trimester. Also during this trimester, urinary frequency and morning sickness usually resolves, but comes back in the third trimester. So the third trimester is going to be seen with lordosis, so an anterior neck flexion, so due to the, again, growth of the fetus, pressing and carrying with the mother. Lordosis and that neck flexion is going to occur. The mother's going to go through lightening, so the baby's going to drop into her pelvis, and that drop on her pelvis is going to press on her bladder. So then we have urinary frequency again. A surge of hormones may also lead to nausea, vomiting, but this is practicing for labor and delivery. During the third trimester, the baby, all of their organs are finishing maturing, and they're growing quite large. And so measuring a fundal height is going to be very frequent during this third trimester because changes are happening very rapidly and getting ready for labor and delivery. So the concerns for pregnancy stages are going to be placenta previa. Placenta previa is when the placenta is detaching from the uterus. And of course, that detachment from the uterus, there's no longer going to be perfusion to the infant. So we, of course, have concerns that it's going to occur with the infant, but also that pulling apart is going to cause bleeding. So you'll see this bleeding and potential for hemorrhage in this situation. Intrauterine growth restriction is the other concern. So this is when essentially anything that's happening to create not enough nutrients or not the right balance of nutrients is getting to the fetus. The fetus is not growing. So maybe on assessment during the fundal height, mom is measuring 12 weeks, but she's supposed to be really like 32 weeks. So there's something that is occurring that's not allowing the infant to grow. And so this is, of course, going to warrant a workup. So labor and delivery, we're going to have 4 stages of labor and delivery. The first stage is going to have an early phase. So yay, I'm in labor. I'm excited to have my baby. Then an active stage. This is really hard work. I don't know if I want to do this anymore. And then the transition phase is when the mom is like, okay, I'm good. I'll just come back later. My contractions are separating. Maybe I'm not in labor. I'm just fooling myself. But really, that's what really happens during the first phase. You start really getting quick with your contractions being close together, and they widen apart again. But the end of this phase, the first stage, is going to be when the cervix is dilated. So the second stage is, oh, my cervix is dilated, I'm feeling some pressure, I need to push. So this can last several hours depending on multiple different variables. Contractions start to space out again and then come back again, and then speeds up till the delivery of the baby marks the end of the second stage. So then the third stage is after the baby is born. Everyone's distracted. Oh, what are we supposed to do next? There's a placenta that still needs to be delivered. Don't forget about the placenta. So the placenta now needs to be delivered, and that marks the end of the third stage, marking the beginning of the fourth stage, which is now after the placenta has been delivered and we're in the postpartum period, and we have bonding, we have milk, colostrum, and all of the jazz to talk about and educate and experience with the newborn. During that postpartum period, we're going to be watching the amount and type of blood that is being expelled from the uterus after delivery. Blood is going to happen, but it should change in this progression. So it should go from lochia rubra, which is dark red, to lochia serosa, to that pink brown, and then lochia alba, which is like a whitish yellow. So over the next month is going to do this slow transition of things that are coming out of here. So it starts to look like blood, and then it starts to look like discharge. And so education to the mom about this is going to be expected and it's going to come out of you. I'm just saying. Our concerns here are going to be preterm labor, which is going to be associated with high or low maternal age, African American, socioeconomic status, just resources and access to prenatal care essentially in that area. But can also be associated with tobacco, alcohol use, late prenatal care, stress, which everyone kind of has stress, or especially right at the end of their third trimester, so can lead to preterm labor. Postpartum hemorrhage is going to be when there's a loss about 2 liters of blood, and it can occur hours after delivery up to multiple days after delivery. So monitoring amount and the quality of the lochia is going to be important in assessing the fundus for bogginess, and interventions I'll get into at a later moment. Okay, and here are the references that I used to create this PowerPoint presentation with all of the images referenced here in APA formatting. Thank you, and looking forward to your questions.